All right, let's talk about one of the most critical tools in your nursing toolkit, short-acting insulin. Seriously, if you're a nursing student, you're going to be using this stuff all the time. And getting it right, it's absolutely essential for keeping your patients safe. So let's dive right in and master this.
Okay, so picture this. You're on the floor and your patient's lunch tray shows up. Looks good, right? Well, for your patient, what's about to happen inside their body is a really big deal. All that food, especially the carbs, is about to hit their bloodstream as a big rush of sugar. And for someone with diabetes, that moment is absolutely critical.
Yeah, that big rush of sugar, it has a fancy name, postprandial hyperglycemia. Basically, it just means a blood sugar spike after eating. Now, for most people, it's no big deal. But for our patients, it can be really dangerous. So our job as nurses is to stop that spike in its tracks. But how do we do that? Well, this is how. We use short-acting insulin. This is our go-to tool specifically designed to tackle that mealtime blood sugar surge. You can almost think of it like sending in a special team to get the body ready for all the glucose that's about to arrive from that lunch tray. So when we talk about short-acting insulin, the main one you're going to see and use is just called regular insulin. Super simple name, but here's a massive need-to-know fact about it, and you've got to burn this into your brain. It is the only insulin you can give through an IV. That's why it's so incredibly important in emergencies. Okay, this timeline right here, this is basically your game plan. You have to know this inside and out. Onset, that's how long it takes to start working. Peak, this is when it's at its strongest, and really important, this is when the risk of low blood sugar is highest. And duration is, how long the party lasts. Your entire plan of care for this patient is built around these three things. So how does this stuff actually work? What's it doing in the body? Well, the best way to remember it is the key analogy. Insulin is like a key. It floats around, finds the little locks, the receptors, on the body's cells, and clicks them open. And once those cells are unlocked, all that sugar from the bloodstream can rush inside to be used for energy. It's really that simple. And that key analogy leads us to probably the single most important rule you need to follow. Remember that onset time? 30 to 60 minutes? This is why you have to give this insulin about 30 minutes before the meal shows up. Think about it. Give it too soon, and their blood sugar might crash before the food gets there. Give it too late, and you've missed your chance to head off that spike. With insulin, timing isn't just important, timing is everything. All right, so how do we actually give it? Well, there are two main ways. For day-to-day management, it's a subcutaneous injection, just a little poke under the skin. But in a full-blown emergency, something scary like DKA, diabetic ketoacidosis, that's when we break out the big guns and use that unique IV route for super fast results. A really common mistake is to think there's just a standard dose of insulin. Nope, not at all. It's always customized for that specific patient at that specific moment. We often use something called a sliding scale. It's a formula that helps us figure out the exact right dose based on their blood sugar right now, what they're eating, how active they are, all of it. And guess who's doing that critical thinking? You are. Okay, everything we've talked about, the timing, the dosing, how it works, it all comes down to one thing: patient safety. That is your absolute number one job. So let's build a little mental safety checklist that you need to run through every single time you even think about giving short-acting insulin. First thing on that checklist, and it's a big one, the number one risk, the side effect you have to watch for like a hawk, is making their blood sugar go too low. It's called hypoglycemia, and honestly, preventing and catching this is one of your most important responsibilities. So what does hypoglycemia look like? You've got to know these signs cold. We're talking sweating, shakiness, sudden intense hunger. Maybe they seem confused or dizzy. These aren't just little symptoms, they're alarm bells ringing. If you spot these early, you can stop a minor issue from becoming a major emergency. Okay, so before you even pick up that vial, you do this 3-step check every time. Step 1, check their blood glucose. What is the number right this second? Step 2, where's the food? You have to lay eyes on that meal tray and know it's there and ready for them. Never, ever give this insulin on a promise that food is coming. And step 3, the classic 3 Rs. Do I have the right insulin, the right dose, at the right time? Check, check, check. And hey, your job is not done once you've given the shot, not even close. Now you switch into monitoring mode. You're keeping an eye out for those signs of hypoglycemia, especially during that peak window of 2 to 4 hours. You're going back to recheck their blood sugar when it's due. You're making sure to rotate injection sites to prevent skin issues. And you know the drill, document everything. If it's not in the chart, you never did it.
Your role goes way beyond just giving meds. You're also a teacher. And honestly, one of the most powerful things you can do for your patients is to teach them how to spot hypoglycemia in themselves. When you teach them what to feel for and what to do about it, you're literally giving them the power to save their own life. All right, that was a lot, I know. So let's boil it all down to the absolute essentials. If you walk away with anything, make it this. Give it 30 minutes before food. The peak and the biggest danger zone is 2 to 4 hours later. Your number one enemy is hypoglycemia. You always check a blood sugar before you give it. And last but not least, remember that you are that patient's last line of defense. You're their safety guardian.
So I want to leave you with this one final thought. What we just talked about, this isn't just stuff for an exam. This is real-world, hands-on skill. So think about your next patient, the very next time you're on the floor. How are you going to take all of this and use it to be the absolute best, safest nurse you can possibly be for them?